Mom, moving on. Or you're staring yourself in the mirror. You don't want to talk anymore.
No, I'm just, men will take our time before we speak. So today is a men's show. Welcome everybody on our show on Oche Kitchen Discussion. And we'll have a special guest in the house today.
Is today Oche Kitchen discussion or bar stool discussion?
It's still Oche Kitchen. Men still sit on Oche Kitchen, so it's still in order. And
Yes.
we'll have a special guest, Chinwe. Thank you so much for being a part of today's show.
Thank you.
And we are quite delighted. We've been looking forward to today's show. And a lot of men have been asking us, why is it that we'll be talking about Women's Day, Mother's Day, women. So we told them we've had this in stock for them. We want to talk about the men. And that's why you could see. Aija, where are you? Are you there?
I'm right here.
So
Yeah, ma'am.
the man is on the ground. Fire on there, man. So tell us all we need to know about mental health. You have our floor.
So
Thank you.
joining us today is a very good friend, a sister. I've known Chiwen for like since I was in primary school, right? Yeah.
Donkey years,
So
they say.
yeah, she's a nurse practitioner in Michigan, USA. So she's gonna talk to us today about men's health because we see a lot of things going on. We see a lot of people dropping down. We see a lot of that, and then you hear, I don't know what happened. He was just doing this. He was just doing it. So Chima's going to help us set some things straight. And thank God Dr. Fiola has time today to join us too. So good.
Yeah.
Fiola, welcome to
Welcome,
the show.
Yola.
So Chinwe, take it on. Can you tell us a little bit about yourself before you start?
Actually, okay. My name is Chinwe Ohaka. I work as a nurse practitioner within the DMC. Started off as a nurse. I've been a nurse for like 17 years, and branch I've been a nurse practitioner for 9 years, going to 10 years. I also have a background in psychiatry, which is my most recent jobs. That is what I do.
Okay.
But also moonlight in family practice, covering sometimes in nursing home. And that's just it.
Thank you.
Thank you. So, talking about men's preventive health measures for men or screening, there's quite a lot that whatever relates to a man is also applicable to women. It's just that we don't do prostate screening and stuff like that or digital rectal exam. But as far as regular physical exams, men are required to do such which is annually. But what I see is that sometimes most of our men, including African American, Black, white, they don't really do what they're supposed to do as far as regular checkups. More so, we Nigerians here, it's hard for us to, sometimes I don't know what could be, I sometimes think about what could be why they don't do that. I have had the opportunity to speak to a guy, and he told me, I don't want to go there and be like spending 2-3 hours waiting for the doctor to come. Sometimes I just feel like I don't need it. So regular physical exams could be done like yearly. At least you go, you have your blood checked, your lipid profile, your CBC, chemistry, all those kind of things. Those are actually screening is the very first step to finding out what is going on in somebody's life. When you go from regular physical exams, they can also do like blood pressure checkups, and then cholesterol checkup, like I mentioned, diabetes, colon cancer, prostate screening, and lung cancer, but more so. So let's start with the blood pressure screenings. I know, we've heard about blood pressures we hear about blood pressure all the time. Check your blood pressure, to have your PCP, check your blood pressure at least once a year. But I would say, and I would suggest that everybody should have a blood pressure like kit in their home.
Yes.
And it's sold relatively cheap at So at least, check your blood pressure. At least if you don't, even if you don't have any blood, even if you don't have high blood pressure, check your blood pressure at least once a month or so. But if you can check it regularly, at least once a week. There's no harm in checking the blood pressure. You can do it yourself or have someone do it for you as long as you have the kit at home. And also know your numbers. And then also when you do see your PC, we call it primary care providers here. I know the UK, you guys call it GP. You can ask your PCP if you need your blood pressure checked often, if you have diabetes, if you have heart disease, if you have kidney disease, or if you're overweight. And if you have a first degree relative, which is mom or dad or sister with a high blood pressure, also it's very important that you pay attention to your numbers, because what they have is also you can always
Like me, yep.
And also if you're Black, mostly high blood pressure affects mostly African American population, of which we are all, even though they call them African American, we're also the Africans. And then speaking about blood pressure, if your BP top number is 130 to 139, or the diastolic is 80 to 89, you consider stage 1. And a lot of time people don't even know. They're walking around with blood pressure 130. No, that's not mine. And you're arguing with them. But when's the last time you checked your blood pressure? They don't even have any clue that they have this silent, high blood pressure, walking around with it, but still acting like they're normal. So the target normal blood pressure should be less than 120/80, no matter the age. Okay. So the ways to lower your blood pressure is by everybody, I'm sure most of us are educated, but still we still have to talk about it. We can never talk about it enough. Reduce salt intake, exercise regularly if you don't, or if you're not faithful to it like me, but I try. Lose extra pounds, limit alcohol intake, quit smoking, get a good night's sleep. I tell people enough, sleep is very important in everything we do, in everything that concerns our head. Get enough sleep, reduce stress, find a way to distress yourself if you find like you are stressed, and eat healthy diet. Okay. So anybody have anything to add to it? You have anything to
I have the blood pressure. The blood pressure. I know some people have blood pressure and they have constant headaches and everything, and some people don't even have any signs or anything. So for people who don't have signs for the blood, like what should they look for? Like if they don't, like I went for my doctor for my annual physical and my blood pressure was like off the roof or something. I'm somebody who thinks she lives a nonchalant life, nothing bothers me and stuff like that. You know what I mean? I have allergies. I take Benadryl every night for a good night's sleep. So like what other signs are we missing apart from like the constant headache that gives you?
What are you doing?
But the funniest truth is that sometimes some people don't even have any like headache or sign.
That's what I'm saying. Yeah.
Most people don't. Some people maybe have like dizziness, but that is why we call it silent, and then sometimes it's also an incident to find it. You went for something else and they found it.
Yeah, and Chinwe, you did say even if you don't have high blood pressure, that it's advisable to just do the check
Yes.
at least once a month.
If you can do it regularly, more than that.
Is that dependent on age, or it doesn't matter what age?
Doesn't matter the age, no matter
so
the
I could
age.
start testing my kids, my little young boys.
Depend how old are they though?
17?
Like at least from 30 years, 35 years.
They say
I said 17, yeah.
I have seen a young adult with high blood pressure. I've equally seen a 24-year-old actually with a tube in ICU. So I would say depending, because that you take them to their yearly physicals.
Yes.
Start off with that.
Yeah,
and then
that's not very common here for yearly physicals.
It's not common with the young kids, but it can.
Young people, absolutely.
But then that's why you do.
Hold on, Chinwe, hold on. You said the young kids don't do annual physicals in the UK?
Not at all.
Really? We do.
Even the adults, we do at 40. That's when you've invited for your first
physicals.
MOT, yeah.
So when they go to their pediatricians, what do? They don't, it's just when they're sick, they go?
The pediatricians get off their case after, when they're below 1 even, that's when the health officers or health visitors, they call them, leave them. So you only take them in when there's a need for you to.
Well, I, I would say because you don't live here, you follow your country guideline. But for I personally, I will still have like a blood pressure equipment
Yeah.
in my house.
What
Which
I'll say,
is
because
what
it wouldn't
everyone
hurt, I don't mind putting that machine on their
does your kids
arm
play
and
sports? Do they play sports? Do they play sports?
yes, football. And yeah, and they do their PEs in school, I guess. That counts for sport.
Well, before here, like here, before they play any sports, you have to have the physical. They will request for that. The school will
The schools
actually,
request it every year.
yeah.
Okay, yeah, they
If
don't do in
not, they will
UK.
not enroll that child because we've had cardiac event like a child running and all of a sudden they sudden pass out like
Yeah.
that. It happens. It's not often, it's not common, but it can, and it has happened before. So that is why they recommend, they will always want to have the physical from the doctor, even if they're 17. Once they start playing sports in school, they have to have it. Even in middle school, is a must that they have to see it. Because when they go, they do the checkup, check them, do the blood work, and also I don't know if they do EKG or stuff like that, but that is if there's any history of cardiac um,
Okay.
disease in the family.
All right, thank you.
Thank you.
All right, Chinwe, what about men? I've heard people that say, "Oh, I don't want to go to the doctors because when you're a certain age and you go to your annual physicals here in the United States, they do the rectal exam, which they have this homophobia issue, especially if your doctor is a male, that they don't want it. So, what do you say to them?
I would say, well,
And
it's
please
okay.
elaborate on the
The
colorectal.
PSA. Okay, the one you're talking about is the postrate. Digital rectal exam has to go with the postrate. You do the PSA. When PSA, let me explain for those who are not in the medical field here. I don't know. PSA is the full abbreviation is postrate specific antigen screening. It's a test that measures the level of PSA in the blood. And PSA is a substance made by the postrate. And the levels of PSA in the blood can be higher in men who have postrate cancer. Now, what is the number? But then also going by what the guideline says, going from what the National Cancer Institute says, somebody can have a normal PSA of 4.0 and lower and they have post-treat issues. So they haven't really been going off of just the PSA level. They've been going with the PSA's level and also digital rectal exam. That is what the guideline says. So if the PSA is high, then you confirm with the digital rectal exam, then the next thing they'll send and if it's still positive, then they'll send the person for biopsy to kind of detect it. So, and they encourage yearly PSA screening for prostate cancer beginning at the age of 50. But some organizations do recommend that men who are at higher risk of prostate cancer begin PSA screening at the age of 40 or 45. And this includes Black men, which includes us Nigerians. And also if they have the germline variants of BRCA2 and BRCA1, which is found in breast cancers. And then men whose brother had prostate cancer, they recommend them to start actually early, which is same with like that. Remember when we started, we talked about like also us, what is applicable to them is applicable to us. Even with the breast cancer, breast screening, they want us to start like 40, but those who have a family history, they want them to now to even start earlier. I remember, for instance, I take myself, I started like mammogram before 40. Ijom, I think I mentioned it to you the day that
Yes, I know. Yeah.
I started at the age of 30 something, so and I've been going and doing it since then, every year.
I started
Anyway,
at 40. Yeah.
but I think I started at the age of 35. They started me off early,
Yeah.
So, and according to CDC, the higher the PSA level in the blood, the more likely a prostate problem is present. But there are also other factors such as age and race affect PSA levels, and also certain medications that we take can also elevate the PSA level. So that's why they don't generally like go off prostate cancer with just the PSA level to be anything. And your doctor is your best person to interpret your PSA results.
All right. You've been talking about PSA, whatever. Somebody who is in Igafu watching this now will be like, "What is prostrate?" So how can you explain? Because some people back in Nigeria they don't even know what prostrate is till something happens to them. We say
Ayar
about
mo
when he doctors now wear prostate to like your prostate. So can you
It's a
elaborate?
gland.
Like, can you
It's a
explain to them
gland.
what prostate is? Yeah.
Prostate is a gland in the, you found it like in the scrotum that when it gets, it can get big, get enlarged, and get enlarged. Yes, yes, you said it right. It can get enlarged. Okay, so when it gets enlarged, that is what they call prostate. It can be called benign prostate hyperplasia, which is this big, and then hyperplasia. Then you start differentiating: is this cancer or is not cancerous? Then
So
those
what
are
are the
where
signs?
biopsy
What are
comes.
the signs for them? So apart from the, I think some of them can pee or can pee, something like that. I don't remember.
They can't, the gland, because it's enlarged, they don't have a good flow of urine.
Yeah.
Okay. So they can have like now you're talking about BPH. They can have like a dripping when they want to
Yes.
pee. The pee, it stops. The pee, it stops. And then frequent urination is one of them too. Okay.
Work again until when you have drippings, when you're about to pee and you drip, don't think that maybe that you didn't drink enough water. At times it might be a sign of something worse. So check it out.
And then frequent urination, constantly going to the bathroom is number one of the early most common symptoms that they say. Okay. Anything else?
Can you talk about aphobia? I know it's changing, but growing up, people used to think that it's a sign of eating well, being okay, and stuff like that.
Aphobia, you're talking about now, you're going into diabetes like abdominal obesity, right? The waistline.
For men, yep.
Waistline is big. So with diabetes is, well, some people think, growing up, we always think, aphobia,
Yes.
but then they worry
Yeah.
sometimes. So not everybody, but know your waistline. And also what they recommend is also all these things comes into yearly annual exam. When you go for your exam, know your numbers, target normal glucose level is less than 5.7. Most times when they have that abdominal fat, it could also be that they could also, most times likely they have like diabetes. It can be pre-diabetic, which is their numbers could be 5.7, between 5.7 to 6 or less than 6.5. And then full-blown diabetes is 6.5 and higher. And also
For men, it's recommended for your waistline to not be more than 40. For us women, is 35. Not be more than 30. I think 35 or 30. 35 for women, and I think so.
On your 134.
That's good. So far, it's less for men. So far, it's less than 40. Yeah, because the belly fat is very dangerous. It's very dangerous. It can lead to high cholesterol, metabolic
Okay,
syndrome, all this stuff.
in belly fat, waistline. Belly fat,
Yeah, waistline, I fucking
waistline and belly fat will be like they go hand in hand.
Yeah.
Like
Okay.
you can have a small waistline and they give you, I forgot about they go like hand in hand. It's all like abdominal obesity, whether it's from the waist, from the stomach, the belly fat is dropping down there, and you see them is talking underneath their belt button, sticking out. Then they have to have themselves checked out, go for screening.
So ndị dị ntakịrị ka ya atụ n'ụjọ.
Oh,
you might, sorry.
Ebukwa diabetes, that very especially like if it runs in the family, first degree relative, and that one is considered type 2 diabetes. If they didn't have it when they're little, then now, then Takiri will be 20 years or 25 or so, the type 2 diabetes. And don't think Takiri did worry for sure. All the other person did believe, And they recommend screening for pre-diabetes. United States Preventive Task Force. I'm not in London. Some people reside in London, but for the purpose of this, I'm just going to talk about where I live. If you have anything to add also from where you live or Nigeria or and the UK, you can also add your own guideline because everything we do in medicine is all geared towards guideline, what the guideline says. For us that reside here, United States Preventive Task Force recommends screening for pre-diabetes, type 2 diabetes in all adults beginning age of 35 to 70, that including both male and female. And that is based on, and that is considered level B evidence, which means it has shown to improve health outcome and the benefit outweighs the risk. So the benefit of me screening is better than me not going for screening. I can go to screening. I'd rather go to screening and say, oh, we caught it at the early stage and we'll start treating you than, oh, had it been you came long time ago, we would have done something better than then it's more like progressive and may or may not come out of it, depends on what it is, okay? Another thing also we should pay attention is that for men also, which is also applicable to us women, is also go for, like when you go for your screening, know also what your lipid profile numbers is. Like I know some of us have heard it before, there's a good cholesterol and then there's a bad cholesterol. I'm just bringing it down to the layman's knowledge. The good cholesterol should be higher than 40, 60, I mean, higher than 40 or at best 60 and above, which is good because at this level, it helps to lower heart disease. And the bad cholesterol should be less than 100, which is the one that can give you a heart disease and stroke. So, and then the
I have a
total
question.
cholesterol.
If your total cholesterol is normal, your triglycerides is normal, but the bad cholesterol is high.
You should be on statin. The bad cholesterol is high. That is the one that can lead the person to have like heart disease and ultimately can also lead to stroke. They can put that person, there's a calculation we use, they can put that person on low, moderate, cholesterol and then low, moderate statin and then take it from there. So, and no doctor will prescribe a statin without first, having you do the first regular, workup, know what your numbers are. Unless they're giving it the person like, oh, if say for instance, the person had like stroke, like I remember when my mom had a stroke for the first time, even though her cholesterol was still normal, they still put her on the statin, because she also had some other cardio issues. So, but for the most part, the most important thing that I would say take home is, go for yearly checkups and go for screening, and then you can discuss with your doctor what your best options are. Because it's from what your numbers, depending on what your number is will also depend on what medicine or what they recommend. I can't just start saying take cholesterol medicine when I don't know what your number is. Okay. So not just what the good one, the HDL, the bad one, the LDL, target should be less than 100. That's how I break it down to even my people in Nigeria. Yes. The bad numbers, the good one has to be at least 60 and above. The bad one has to be less than 100. And your total cholesterol altogether has to be less than 200. 200, yeah. That's what you know. And then that is also based on the United States Preventive Task Force recommendation.
Yeah.
So,
all right, we have Fiola, who is a medical doctor from the United Kingdom.
Okay.
Fio, can you unmute yourself? And tell us why you guys don't do physicals every year, or at least every 2 years. Fiola, are you there?
I think she's there. She's on mute.
Fiola.
Oh, is there anyone that is live in UK that can tell us why they don't do like the physicals? Because the physicals is where they do the screenings, or like.
Fiola is the only practitioner.
What about a nurse? We have a nurse in here.
Esther. I don't know. No, Esther is not a nurse. Esther is in the housing thing.
No, Esther is a nurse.
I'm a mental health nurse, so
okay, all right. I'm sorry.
It's okay.
So how come you guys don't do annual physicals? I don't get it.
I just think that because the NHS, they prioritize. I think like, when you get to about 40, I think they do that screening. But before then, if they look at your family history and you have maybe family history of heart disease or cancer, certain things, then they will start it early. But other than that, they will not prioritize you. So I think that's the reason why they don't do that. And like you said, for children, they don't do it unless like once they have all the MMI injections and stuff. That's it. They leave them alone unless there's something wrong. then you take them. So, I mean, I think we should adopt the American way, actually, because that sounds much better. So, yeah.
So if somebody looks okay, feels okay, but has been running high blood pressure and doesn't know it till the person strokes out.
Well, yes. I mean, like what you mentioned about children. I think that is actually a very relevant thing, because like for children, if they're playing sports and stuff, definitely, I agree. I think they should do the check-in and know what their baselines are, but they don't do it. It's never. I don't know why. They just never do it. So this is something that's actually good to maybe we have to raise it with the government here and say, why are you not doing it?
I think their medicine is get more towards like our medicine in Nigeria, because even in Nigeria, I don't even remember going to a physical. Again, I guess ours over there is
We didn't know better then. They say if you know better, you do better. We didn't like there was no health awareness in Nigeria. The only time we went to hospitals was
when you were sick.
typhoid and malaria. So we didn't know, like
No, I guess it's slightly different in Nigeria. If you have
Insurance.
everybody in Nigeria that pays for their
Class
medical visits, so they can afford to do it yearly if you want to do, or go to the doctor every 2 weeks for your malaria injection and all of that. With UK, I know they're not going to arrest me, but I'm going to say this. One of the reasons why they don't do that is the cost. We apply the same insurance system which you do in the US. So there, what they do is everything is being paid for by people who are working, and probably partly funded by the government, depending on what sector. So they cannot afford to do things that are not necessary. And I'll be honest with you, if I was called into a day check every year, I will find it irritating. Coincidentally, I have a clean bill of health to a large extent. So if you keep calling me to take my blood and do all of them, I feel what's the need. And I bet you most people would miss appointments.
They don't.
Thank you,
In the US, they don't call you. Okay, in the US, yeah, they don't call you and say, come in for your physical exam. You are responsible to make an appointment and go for your physical. And I tell you what, even in kids, like I'll take my kids for instance, my daughter, she's 18 now, but last year she was 17, and her and her brother is what, 13. They went for a physical, and they found out that their vitamin D level was so low.
Yeah.
Was so low that the pediatrician had to call me and call in a vitamin D 50,000 units, which she said they have to take it once a week or so for X amount of time, and also give a refill. So now vitamin D, it prevents some form of cancer, and also, the bones, like kind of like helps with the bones. So no, if these two kids did not go for their physical, how would we have known walking around playing sports? Oh, everything is fine. So screening is good. Yearly physical is good, because that is when they find those things, when you do the blood work.
My daughter,
bottom line is the cost.
9th or 10th grade, we found out she had, like, her cholesterol was climbing up, and then we fixed it and it came down. So these things are like, you can't say you don't know. Like I told you guys like last month, I went for my physical. You and I talk, we see every week, we talk all the time. I feel fine, but my blood pressure was off the roof. So what if I had stroked out? You'd be like, Mary Joma just zoomed yesterday. Mary Joma was happy yesterday. You know what I mean? Then some people say it's my village people. It's not your village people. So you can look well, and look at me. I look healthy. That's if I'm, you know what I mean? So you can't judge.
I think I'm like
you can't judge that you're okay by how you physically look.
Like Chinwe said. All right. First of all, let me answer. That's why I asked the question. How do you know you have a clean bill of health if you don't go to check up? Occasionally, when I'll have to go for one thing or the other, that's when they want to do a blood test and say they haven't done blood works. They'll do it and everything has been okay. That's the answer to that. Sure, like something you said, it's your responsibility as the patient to call in for those annual checks. So assuming people don't call in for 5 years, would anyone prompt them? Or would it be?
Yes. So once you go for that first year, they'll remind you the next year. They'll call you a week, say, oh, your annual physical is due. But you have to at least get a doctor for the first time, yeah. And at times some doctors will schedule you 1 year ahead for the next one too.
I was gonna
Or you
say,
have to make the initial call. Yeah. Sorry.
yeah, I was gonna say some providers do, but some don't. It's up to you to pay attention to, what is best for you. Some know that this is, I had my physical, like say for instance, I had my physical May last year. So around May this year, I should be due for another one. Now, some providers will schedule you even before you leave out for the next one, for the next year. Some will not, some will call you to set the appointment, some will not, but it all depends on how that private practice, how they operate. If they have a huge, like volume, like a lot of patients, they may not.
UK defense, I think if you demand it, you will get it.
Yes,
You have to say no.
definitely.
Yeah, if you
Yeah.
go and tell them every year you want to do blood work, you want to
Yeah.
check PNC, I guess your GP will not say no to it.
So your
Hello.
jobs don't ask you for
Okay,
annual
Fiola,
physical.
Fiola is here and
Sorry,
Fiola,
sorry.
I beg, this thing, I'm angry
Lana
at you
said you
guys.
guys were calling my name.
yeah, we did.
Because we're practitioner for London now. Yeah.
I feel like I told them in UK that we don't have annual physical checks, except when you're 40, and after that, nobody reminds you again.
It depends. It depends on what you mean by what sort of physical check are you talking about?
For us, annual physical is you go,
Annual
they check your blood
exams,
pressure, they take
regular
your
physical
urine, they
exams.
run blood, the doctor checks your nodules, your everything, checks you. Like I checked to a male
MOT.
doctor to a female doctor. My female doctor is so thorough.
You
She'll have me do all this.
you need to
what is called?
understand. You need to understand that in the UK we operate the National Health Service. It is a free service at point of care, but it has its limitations. There is no way it is not affordable, it is not sustainable to do that on such a scale. For what it's worth, they do offer annual checks, but we call it the 40 over 40s. So once you hit 40, you get an invite in the post by your GP inviting you to go in, and you go and see the nurse. You have your height, your weight, your BMI checked.
Yeah,
you have basic blood work done, aiming to check for cholesterol and your blood sugars, obviously for diabetes. And then they'll do a blood pressure check. And you'll be amazed at the number of people that are picked up at that screen, because lots of people under 40 hardly go to see their doctors. They are the working people, they are the busy people, the people with young children. They don't have time to be going in. And if you are in the UK at the moment, you will know the pressures on the health service. You cannot see your doctor now for love or money. They will ask you to ring at 8 o'clock. You're on the phone for half an hour, 1 hour. By the time it gets to you, tell you, oh, you're number 50 in the queue. By the time they finally get to you, they tell you all appointments are taken up, and they ask you to ring again the next morning. It is a nightmare at the moment. So you can understand that if the pressures are so hard that they cannot even see you for an acute issue, no one is going to have time to start begging you to come for a check, because it just isn't the capacity to meet that demand. So the answer to your question is yes, they do an invite at age 40. And if you are picked up, maybe pre-diabetes, they will enroll you into a scheme. You go into some training, they repeat your bloods in 3 months. If you're still this, they'll follow you up, basically.
Managing you. Okay.
Yes.
Fiola, let me ask you a question.
Yes.
Not having that, how, what do I put it? That regime, that yearly regime, similar to what the US have. Do you think it has an impact on our health?
Absolutely. Like I said to you, if you know the number of people that are picked up on these screens, you'll be amazed. Okay. Even my daughter keeps complaining. When was the last time she saw a doctor? But no one will screen you or screen a child until the child is ill. It's unfortunate, but it is just the way it is. And it has its positives. It's amazing that no matter what is wrong with you, you go to see the doctor, you turn up at A&E, no one is asking you for a penny. It doesn't matter what sort of illness you have, be it the rarest cancer on earth, be it a heart attack, be it being you have to be on life support for months. It is absolutely free. It is amazing. It's a gift that we cannot,
Spread for anything.
yes, exactly.
For
Okay,
us
but
here, for us, it wasn't free before. You have to pay for it with your insurance and everything till
yeah,
Obama came. Because many people weren't going because they didn't want to do the copay and stuff like that. But Obama made it that every like the annual physical, annual OBGYN is,
yeah,
and your for us
no,
the
but wait,
breast
that's why I
is
asked what
free.
sort of
So you don't
screening,
pay anything.
because there are other screenings in place. So it's like there's a cervical screening every 3
Yes.
years for the women. There's the mammography for women over 50. There's the bowel cancer screening. So there are screening programs in place. So it depends on what you're talking about. But if you're talking about this physical, no, we don't. But if it is picked up, they will take good care of you. So it's just one of those things. This catch, 22 is not perfect, but it is what it is.
So we don't fix it
But
until it's broken.
I think every health
That's essentially what she's saying. Here, every September when the school starts, your child has to have it before coming back to school.
That's
And jobs,
amazing.
I know
That's amazing.
some jobs like my old job used to, not really, they just started,
But
but most
but all
jobs
that
every year you have to
is paid for by your insurance, isn't it? The child would be maybe under their parents' insurance or something. Is it?
yeah.
Yes.
And some people
Yeah.
are under the
Yeah.
government, some people have the government insurance too.
Yeah. I mean, for
we have
what it
Medicaid.
was, I also work in the private sector. If you have private insurance, the sky is your limit, okay, for anything you want here. You bring your child, there's absolutely nothing wrong with the child. You just want the child to see a pediatrician for a head to toe physical and all that. As long as your insurance is happy to cover it, I'll sign for it. It's fine. You can go for it, but you cannot do that on the national health. Okay, or you come in, you're not due for your cervical screening yet, you're not due for your mammography, but you feel you need one, you feel you cannot wait till next year or 2 years, you rather have it done now. I'm happy for you to do that, so yeah, that's the joy of private service, or if you have your own money to pay for it. But on the national health, we can't do that.
Okay, let me ask you.
Right,
I got a question for her. So now, let me ask you a question. This is based on what you talked about, the way the UK runs their health system. Now, for instance, if someone has a family history of strong family history of colorectal cancer, and they come in, they have to do that screen, and they up to the age of 40. What would they say? Would they keep the person in the line and say, wait until we bring you?
Oh, no. No, because we take family history very seriously. So if you have a family history, a near relative with a diagnosis of cancer, you are automatically routed to a clinic called the Family History Clinic. So let's say Mrs. A got diagnosed with colorectal cancer. They'll ask her to get her children, her nearest relatives, and they will give them letters to go and see their own GPs, who will then because obviously they may not all be living in the same city, and they will now go and see their respective doctors, who get them into the clinics in the area, and they will then go under surveillance.
So from what you're saying, your health system is run like, the only difference is that you guys run a universal health system.
Oh, yes, we do.
As opposed to us that we don't. But it's almost the same thing, the same practice guideline. It's just the person has a family history. Now you guys are sending him. But here, regardless if you have a family history or not, because you have a private insurance, once you get to the age of 40, whether you have any family history or no family history, your doctor will refer you to go for colon screening.
Exactly. Exactly.
Yeah.
So, but we don't have the joy of private health. If you have private health, you're either paying for it out of your pocket, or you're fortunate that your employer gives you this thing. But other than that, we all have to go on the national health.
And also,
I feel like coming back to the men. You said once they hit 40, you guys invite them. How many men do come for the physicals? Because
no, it's not just men. Everybody.
Do you have a high percentage of men coming? I know women want to go, but what about men? Do you guys have men come too?
To be honest, lately we are getting a good turnout, and I will put that I will attribute that to social media and more awareness. Okay.
Yes.
Yes.
Because there's a
Compared to 10, 15 years ago, if I walk into surgery and I look at my list, I can guarantee that 80% of the people on the list will be women. Okay. A man will only come in if they're dying, or if their wife has complained and complained and complained, and then they come in. But
Or
now
drugs them
there's
there.
so much awareness, especially in the younger age group. Okay, the 20s, between the 20s and the 30s, under 40s, they are amazing at being very conscious of their health. They are the ones that are watching what they eat. They're the ones that go to
That's
the
it.
gym. They're the ones that are reading up everything that comes up online. They're more, they're looking into, oh, this is a factor for me. This is a factor, whatever. They don't even wait till they're 40. They come in, oh, doctor, I read this. I had this. I checked on Google. The bane of our lives now is Dr. Google.
Mm-hmm.
They put something
Yeah.
in and
all is
Google
social
says,
media.
yes,
Social
it has
media
its
doctor.
positives, but it's also creating unnecessary anxiety.
Aproko
Because
doctor.
I love him. I love him.
it's again from Ibiarana.
Apoko doctor is a guy who does
I'll send you his link.
Oh,
Yeah, he talks on TikTok and all that.
videos. Yeah. He uses broken.
Yeah, so I mean, social media has its positives and I would rather look on the positives, because you see this younger generation being more health conscious, being taking more responsibility for their health. So yes, the answer is yes, they are turning up,
That's
and
good.
it's all for a good cause. Yes,
So the 40 plus guys are not turning up, only the younger ones.
compared to the older ones, the younger ones are making more of an effort. Let me put it that way.
You mean in terms of men?
Yeah,
In terms
yeah.
of guys?
But the older ones are either they've already been picked up, but they already have a diagnosis. But even right from time, men have always been more reluctant to,
I don't think the number have changed so much, even with because there's one article I read while in school that men, don't their number compared to women, the percentage is low going to the doctor as
Very
opposed
low.
to women. I think even if there's a change, it might not have been a significant change that the
They'll tell
study
you
has
something
seen.
must kill a man.
Yeah.
No, I mean in the younger age group, they are doing better compared to the older age group.
Before uncle.
Somebody said health anxiety is on the increase and dependence
Yeah,
on.
Esther. Yeah, I wanted to ask you about. Yes, I wanted to ask you about do you guys see men with depression, like anxiety, as a mental health nurse?
Yes, you do see that. And the problem is there's a strong relationship between, health conditions and mental health, and the other way around, And for a long time, I think we treat them separately, but the NHS is realizing that the two things are joint, together. So because my job is to stop people relying on A&E and calling London ambulances and NHS 111 when they're not needed, so that the ambulance can attend to people who are having heart attack and stroke rather than for other things. And to do that is very difficult because, like you said, with this social media and stuff, people just panic about all kinds of things. And unfortunately, GPs, since COVID, you can't get appointments. Sometimes you have to wait for 2 weeks for, appointments and stuff. And people get so anxious about things. They want to go to A&E. But A&E is not going to give you necessarily the test that you need when you go in there. And it's about making people understand that the best person to go to is your GP, regardless of how long it's going to take. You need to get that GP appointment, because sometimes people think, oh, if I go to A&E, they'll do the test I want. They're not going to. They'll do
You
the
guys have
basic
a
stuff.
shortage of doctors. Do you guys have a shortage of doctors? Is that the
It's
problem?
not necessary. I don't think it's necessary shortage of doctors. I think it's because of the way the system works. Where you just call your GP and you try and get an appointment. If everyone is calling or everybody's going to A&E, there's not going to be time to actually deal with everybody, because you have to kind of prioritize. It's a priority system, isn't it? Because you have to look
Yes.
after the people that are more immediate. And sometimes, you end up spending hours in A&E, and it just gets like that. And then people just sometimes don't stay, they leave. And then you have people that actually are unwell, but because they don't want to go to A&E and wait for that GP appointment, they tend not to then deal with their issues until it gets worse. So it's a very difficult kind of system.
Your system is kind of like tight though. I get it. I like the system where I can, the universal health system where I don't have to have any bills, after I see my GP. But think about it also in this system, I'm sure there have been a situation whereby one can be like waiting to see the doctor and the condition to
And they
deteriorate. By
bite.
the time they get to the GP, instead of
Well.
calling, maybe, let me say for instance, stage 1 cancer is now stage
Yeah.
3.
Yeah.
Oh, yeah.
Yes.
Or
And it
bite, or
happens.
they don't bite.
Yeah.
And it does
Okay.
happen. But what you have to understand is people, I feel like, you know what, we don't have to overly rely on the NHS. If you're able to afford it, or you're lucky enough that your employee has some kind of private this thing, you take it. It's like, for example, you can't get a chiropractor on NHS. I recently had to go and see one for my back because I've been relying on physio from the NHS and it wasn't doing anything. But as a staff member, I'm educated enough to know where I need to go. So I have to pay for it, And so I think sometimes we, in the UK, we need to sometimes get out of our head about this free service, because the free service doesn't always be available for you when you need it. So, yeah. So sometimes to get the best of both, for me personally, I do both. I have my private and I have my this thing. And where I think I can go for the NHS, fine. If I can't, I'll go to my private. I use my private. So I think people need to get out of that over reliance, because I think the NHS is not going to be able to sustain going forward. Something has to change.
Okay, so even within the universal health system, you can also buy your private
Yes, you can.
insurance.
Yeah, you can. You don't have to wait.
Yeah. Okay. Yeah. For the purpose of today's topic on men, we would like to hear more on advice for men in relation to sex, their sex life. Let me not just say sex. To their sex
What
life.
make Chinwe go fit for you here?
Anyone that has any advice on men's sex life should bring it on. That's what I'm.
So now, okay, Chinwe, I'll ask you directly now. You touched on prostrate.
Prostrate.
The story that's going around about prostrate 21 times a week.
About what?
Side chick if your wife cannot do it 21 times a week.
No, it's a month. No, week. It's a month.
He's talking about ejaculation. It doesn't have to be actual sex, so you can masturbate and
Ijoma, are you talking from the books? Chiwe?
I haven't heard about that. I haven't read about it. It's just
I make sure you send out the clip, so you need to read it.
Is it based on the guideline? Anything that is
the doctor said it online.
A study.
What guideline?
Mm.
What guideline is saying have 21 days of sex or whatever?
No, 21.
Not 21. It's a month.
21 times a month.
A month, yeah.
Time a month. Oh yeah, absolutely. Yeah, you have to have actually like how do you say? I've forgotten the right word to use, but it's good for a man because what they have seen also, like how
ejaculate. Yeah,
they get it and they don't do that. Yes, absolutely. I didn't know. I thought you said 21.
No, 21 times. 21 times a day. Mwapa can't even finish it. Let the whole world managing that. No, not possible. So, all right, yeah. So that's very important. It's not something we'll have to neglect. And outside prostrate, looking at it as a prevention to prostrate. Generally, what do we advise men in terms of their sexual life and how it will improve their well-being? Fiola, you can add to this as well, Chinwe. Please, we need because
sorry, what was your question?
About men.
What was your question?
Well, for men's health, yes.
Yes.
How important is it for their sexual life and their well-being? What's the correlation? And this will go down to depression as well. So
see, it's not just about the prostate. You also have to think about, there's another important thing you should not overlook. Testicular cancer is also an issue for men. Self-examination, checking their balls is absolutely important. Prostate, obviously, watching out for those symptoms or urinary symptoms that can, raise flags for them. Yeah. What else?
Okay,
breast cancer. Breast cancer.
So we're talking about men. Oh yes, breast cancer. Thank you, sis. Yeah, thank you, sis. And like Fiola told us when we did the women's health, you have to look at it. So every morning, carry it in your hand, your bola, your bullet, whatever you call it, your shotgun. Carry it, look at it. Make sure there's no no
What are
boils,
they looking
no
out for? That's
spikes.
another question now.
You
Yeah,
mean
that's
regarding this thing? So
The boss, yeah, what are you looking out for?
okay, so you know how we talked about the breast is the same for the guys, okay?
Mhm.
I mean, guys are actually quite good at looking at themselves.
Yeah,
They're quite familiar with that
very,
part of the
very.
anatomy. Yes, they are. You know, they know what it feels like. They know how they hang. That's the way what they call it.
Yes.
They literally know the size of their balls. You know, they can feel it, one hanging higher than the other. They will be the first to tell you that one feels somehow, you know, or the other. And then, you know, and it's also important that you get your partners on board. You know, let your partner, let your girlfriend, your wife also be familiar with that part of your anatomy. So that in case you miss something, they will pick up on it. Lots of women have been able to identify that, hang on, there's something on, I can feel something different. Okay. So it could be anything from a pea-sized lump sitting above or below or on the side of, you know, one of the balls. It could be some color change. It could be it's hanging funny. It could be the texture of the scrotum is feeling different. You know, no matter what it is, yeah, it's worth checking it out. Testicular cancer is one of those cancers that if you picked up quite early, it's quite good. But unfortunately, it spreads quite quickly and it's quite, you know, it's a killer.
Particular
So just
cancer like runs between the age of 15 to 45, just so you know. I mean, also, it might have been the older you get, less likely you have that. But generally, it's in between the ages of 15 to 45.
Okay.
15
so
years.
15
yeah,
years.
it's yes,
15.
young people, yeah. And
Wow.
yeah, so it's
I
something
didn't know
that
that.
yeah,
Mm.
you have to be quite observant, okay,
Okay.
because the earliest symptom is the appearance of a lump, okay, or changes to the balls. Yes.
What makes you
Okay.
start so early in life?
It's one of those things with cancer.
Hormonal.
There are types of cancers that you know have an age kind of. It's not. It's just like when we're talking about breast cancer. There, you
Mm.
know, it's more this thing at a certain time in a woman's life. So for younger men, it's at that point in time of their lives that they are more vulnerable. There's lots of factors, you know, that you know
Okay.
that go
Still,
into it,
yeah,
but
thank you. Thanks, Phil. Still talking about their sexual life again for men.
Fama, you too like this thing.
I have to because that's very important.
I think
I
Even
trust.
if you like this thing, for
Too
sure.
much. Let me continue. Now, the question again is
mm.
where there's this talk in the world, it may be true, may not be true. My neighbor said it's true sometimes, that the older they get, their performance declines. Or some young people even have problem, erectile problem, or erectile is not coming up, Abby, or it's not lasting and all of that. What
Yes.
advice are there for men and what should they do differently or try to see how to improve things? And at what point should they be shouting, I have a problem? I would like to know.
The problem with erectile dysfunction is that it's one of those things that men are reluctant to talk about. And it's a thing of pride for them. They would rather pretend nothing is going on, they'll pretend, you know, than to actually admit that there's an issue. But it's actually more widespread than we think. And the issue with erectile dysfunction that a lot of them are due to an underlying medical condition. It could even be something. Some people have been found to have diabetes because they had erectile problems. So diabetes is a major thing with
You're right.
erectile dysfunction. Yes.
Yes.
Neurological issues, the more exotic ones as far as multiple sclerosis or the Parkinson's, the rest of them. But, you would have severe symptoms, that will point to that. But the commonest issue with erectile dysfunction is psychological. So a lot of them have to do with anxiety, performance anxiety. And this is more common in younger people, and funnily enough, the way to address it is actually to talk about it. So the fact that they're reluctant to talk about it makes it worse. But the more they're happy to open up about it, get their partners on board, open or talk about what they're worried about, the easier it is to get, to the bottom of it. There's actually, so for us here, if a gentleman presents with erectile problems, You do a basic examination, you run the test, you make sure there's nothing physical underlying. You, from talking to the person, you get a feel. You start to ask, has this been going on? Like I had a patient the other day, and it turned out that this was his first relationship, and he was now having erectile problems. So we didn't even have a yardstick to compare. So it's not like he had had a previous girlfriend, and this was now happening. So I could tell that it was more of pressure,
Anxiety.
tension, yes, anxiety, trying to impress his new babe. So you can actually tell sometimes when there's
So what did
something.
you tell? So what did you tell him?
So, once we made sure that there's nothing physical on the line, we have a special clinic, and we have people trained. They're called psychosexual therapists, and they run this special clinic, and that is what they focus on. They have lots of, strategies that they use, from talking therapies to actually teaching them, maneuvers, like those of them that maybe come too quickly, trying to use maybe condoms or an extra condom, how to, do stuff, how when you're about to this thing, you withdraw, you start again. They go through lots of, whatever, and it's like almost like going to school. They'll actually teach
I
you
never
the
knew
steps.
that exists,
Have you ever had that problem?
No.
So,
I was gonna also add to you.
I feel like Chima, go ahead. Sorry.
I was gonna also add to you that when they come, you also have to look at the medications, because I had a similar situation. The medications can cause that, and some
Side
medications
effects,
that
yeah.
do take. I have a guy that he was just started on prescription medicine, and then he said he had sex with his girlfriend, and his thing wasn't standing. And when I did the review,
What is his thing?
the metoprolols and the medicines that the LOL can cause that. The metoprolol, the labetalol, those things, yes. And I told him, absolutely, we're going to take this medicine off. And he was like, I want to take no more blood pressure medicine. I'm like, no,
Yeah, especially some of the mental health medications as well do that, don't they? Has that kind of effect a lot of times. Yeah, I said a lot of times the mental health medications as well has those, on impact on your sexual, for men. So
when you do it,
My advice for the younger ones who doesn't have like a health condition or anything, make sure you exercise, make sure you eat lots of fruits and vegetables, your greens, your reds, the oranges. And when you're inside, don't think about coming. And when you feel like coming, withdraw, do something else, kiss up, do something else, change strategy. You see, you don't come, but because when you go there, it's like you want to go there. So that's one of the strategies you can use to stay
Pam,
long.
they will employ in that psychosexual health clinic.
Exactly. It's as if you do
Oh, yes,
it.
You will shine there well,
it.
because that's the sort
If
of
you
thing they
stay
talk
in one,
about.
one position will make you come so quick. So you
Yes,
just have to, as your
they go into details. They go into detail. They'll ask exactly how do you do it, what do you think about it, and you do well there. Maybe we should open clinic.
If my
The only other thing,
I was a good student. If my mama taught me well, I was a good student.
Yeah.
the other thing I would
That's why
say,
I've been
I think the other thing I would say is that I think it's for women to understand that, sex for men can be a stressful thing, because I think sometimes we underestimate
Pressure.
Yes.
Esther, you muted yourself.
if we then are aware that, that is can be a stressful thing, and be aware for those things, we can also help them.
Oh, definitely. It's when you hear performance anxiety, who are they being anxious for? Who are they under press? It's the woman. So if you come down to their level and make them feel at ease, and and don't be critical, don't be so judgmental when it happens, because they will just lose face, and it can be very demoralizing.
Yeah,
another way to help them is if somebody like the young boy you were talking about, they don't have to go all the way. She can help him ejaculate, with the first or second base, and then after that he will relax, and then he can, enter and finish off.
Pam, that one is above my pay grade. My own is to make sure there's nothing physical on the line. Then I can post you to the clinic. They will then go through this. Sometimes I went to this thing at the clinic and I was listening to what they were doing. I was really quite impressed. I found it very entertaining.
Yeah, it is.
Yeah, so but they have the luxury of time, so they can take a lot
Okay.
of time to talk through all that. I don't
Yeah.
have that luxury to go into all the details. Are you on top? Is she on that? Or she? I don't have that kind of time. So,
I would like to ask.
Ibuliria, look Ibuliria like
yeah, it got a local time. I know. I would love to.
Yeah. What I wanted to say is I think we have an opportunity sometimes to talk about women's health and in totality. I want to know about the sexual pressures and how it affects women as well, because it's as if I will accept it today because we're talking about men's health. So the anxiety in bed, okay, they'll take that and we know how to go about it.
Yeah, no
And before
anxiety.
we end, because the conversation is quite interesting, I'm sorry, I want to start talking about now. The next level is depression. From the medical side, what is the common reason for patients or male patients that you've seen who are going into depression?
It's money.
Chima, do you want to say anything about it?
I have no clue on that one. What is the
It's
most
money.
important
I
trait?
can answer that. It's money because a lot, like we mentioned last week, a lot of men are under duress to provide, to do this, to because there are so many girls who want to turn out with ballers and everything. You want to, for a guy to talk to a girl is like, even in Nigeria now, I heard you can't talk to any girl without bringing out something, which is worse than when we're growing up and everything. So a lot of pressure. So most men who are depressed, their first issue is finance. A lot of
Okay.
Yeah,
I would
think
say,
there's a lot of issues tied to that depression thing.
yeah,
There's a
yeah,
lot it's than
yeah.
just
I would say just because men don't tend to talk, like women, we can talk a lot and with each other we can share issues, and we, at least as a woman, there's one person that you can go and be vulnerable with and talk about your issues. But I feel men, they don't really bond on that level a lot. I mean, I don't know if there's any men on there to kind of talk and see, but I feel the lack of talking about issues and stuff, they keep a lot of stuff inside them, and then they overthink, because then naturally men are overthinkers, and they overthink and they become obsessed with the thoughts and stuff, and then before you know it, it becomes, they're feeling depressed, they're lacking motivation, and everything just gets on top of them. But as women, we will find strength to talk to somebody at least, and draw some strength from someone, and someone say, okay, you know what, I know you're going through this, but maybe try this, take it easy, and that helps us to feel a bit more able to cope. And I feel with men, they keep a lot of things. So in my job, like I said to you, sometimes people are going to hospital a lot. Actually taking the time and speaking to someone and finding out and undoing the onions of layers of issues and stuff, his family, like you said, his finance, his responsibility. Oh, there's so many things, and you need to have that time, and men need to find somewhere to go and get that help they need.
Yeah, there's a project. There are befriending
go ahead.
projects in UK. I don't know if you have it in US, where it's a project where people are there trained to talk to people, to keep them company, just make them speak. Okay, yeah, that's one of the things I understand. Men are known to bottle things in, don't talk. They think we can brave it, we know about it, we could do it. And another very important thing is rest.
Before you go into rest, another thing I know that weighs men down is divorce. So men don't take divorce very well.
Social issues.
I read
Yeah,
what
for the most part, most times when they get divorced, it's so tough on them when
So
they don't
let's
have
stop
that
divorcing
family.
them then.
somebody just wrote on there. She agrees with what you
If
just
you
said.
want to stay, you can. Anybody who wants to stay can comfortably stay. Yeah.
Yeah,
Because we
but
don't
you
want
know
them
what?
to
There's so
die.
socially, if you think
Working for
about
you,
it,
you
so
can stay if it's because you can't stay to help somebody at your own detriment. It doesn't make sense.
But you keep
and I
telling
think
us not to ask
You
them
can
for
stay
money.
for him not to be depressed, and then you be depressed. So what happens to you?
Okay, somebody just agreed to what you guys were saying. I just read what he chatted.
Go
Benson
ahead.
chat is good. That you guys are 100% right. That men don't like to talk about those things. A lot of things that
Thank you
Yeah.
very much for reading
That's
that.
why it's good to have friends of the opposite sex, because I think
Yeah.
like men who talk is like, you know what I mean? If you're having money issues, I think it's easier to talk to a female friend than a male friend, you know.
Okay.
So having
But
like
some
sexual
men are like anti-women. They don't like to
Don't want to talk to women.
Yeah, about what is going on in their life, so you have to like almost force it out of their mouth. Some don't like to talk. They'd rather
Yeah.
talk to the fellow men. So it's like, all that like African mentality, like woman, why do I gotta talk?
Yeah. And I'm sure there's so much we've not touched on this topic. And but the last not the least is rest. I find that some men, very handful of men I know around me now have decided to take holidays with fellow men and with their friends.
Yeah.
Yeah, it's different doing things with your friends and doing things with your family. Completely different things. So nobody can come and sit here and tell me it's the same thing. It's not.
No, it's not.
So when
I
you
100%
lay
agree with
that
you.
down with friends, is different. I have a friend and another friend, I think about 3 people who have actually had group holidays in a company of just men. And I found it very interesting. I said it was good. So it's
It's the
important
best
for me
thing.
to,
You go on girls' trip, so you know it's the best thing.
yeah.
Go
Men
do
need
golfing,
they need to
fishing,
relax.
play chess, whatever. Yeah.
Yeah, and
Yeah,
they will
we
tell you I don't
Family,
have time. You know,
girlfriend,
that's for
wife.
women. Women, well, I don't have time to go on
No.
holiday. No, you should
Yeah.
create time.
we
Create
have to
time for
encourage
them.
them.
Yes.
Encourage them to go on those trips.
Yes. It's
One is
very,
good
very
for the goose,
important. Yeah.
for the gander. Yep.
It's very important. It's been an interesting topic, and it's as if we don't even want the time to go. It's over an hour since we started.
I noticed. Yeah.
And I feel we haven't even said much. But anyway,
Yeah.
thank you very much, Ewan. Thank you so much
Thank
for
you.
being our special guest today. Fela, thank you so much as well. You're always there backup, giving us what we want to hear. Essie, thanks for your contribution. And everyone who's participated today, you could see that me and Wapa, we are the men in the house today.
Yes, so you see our mustache.
You can
You see
feel
our
it. You can
mustache
feel
and
it. Yeah.
our yeah.
Thank you, Chim. Thank you, Chima. Thank you, Sheila.
So, Ben, yeah, we're here to keep you coming. You keep saying that we'll keep talking about women. We are the men. The women here are Esther and other people.
And we don't hear
are the
from you
men.
today. We don't hear
We're
your
here
mouth
for,
today.
we're
Come on,
rooting
don't
for the
fire.
guys. And
Unlike
what
you.
I'll say, our final words from Oche Kitchen is, men, please look after yourselves. Do
Yeah.
your annual checks. Take
Yeah.
a break. Speak to people. Speak to your mother, speak to your friends, speak to your wife, speak to your girlfriend. Anybody you could speak to them. You have our permission to speak to people.
And
Colleagues
once
at
in a
work.
while, leg up so your woman can look under and see if everything
If
is okay.
there's any, yes, I want to talk about that. Let them check your
Anyway.
pulse. Yes. Doctor said, get your partners to help you check it.
Yes,
If you've never checked any today, before now,
Start checking.
go and
Start
check
checking.
one. Go and check. Whenever that is
hold
very
it like
friendly,
this. Hold it.
just check it. Yeah, it's very, very important because we want to save lives. And
Yes.
for our younger ones, if your doctors are not calling you in for checks,
You can
my
call
doctor
in.
hasn't called my kids. I may have to start asking, please, can my kids be checked
Please
out
do.
for A, B, and C? It is important. We need to save lives. And today we are out to talk about men and let them help themselves. We can't just, well, we would help check if it's balanced, but they'll have to help themselves and go out there. Keep to your appointment, give yourself a rest, speak to people, and do the necessary things. Thank you so much. And we hope that you'll join us in next week's show. Thank you. We love you all.
Thank you, everybody. Love you guys.
Thank
We're
you.
going offline, but we could stay in for extra time if you have the time to be with us.